Do you have mid-back pain or thoracic pain? What are the causes of mid-back pain or thoracic pain? There are a lot of causes for this type of pain. It is important and crucial to make the correct diagnosis quickly because certain causes or etiologies are urgent and should be diagnosed and treated quickly. If we look at the thoracic spine, it begins from the bottom of the neck to the top of the abdomen. There are 12 vertebral bodies that make the thoracic spine or the dorsal spine. Between each vertebral body, there is a disc, and behind each disc, there's a canal or a neural canal that we have a nerve that exits and loops around and supplies the chest and abdomen area. Also behind each vertebral body, we have what we call the facet joints. The facet joints is where the spine connects from the back connects to each other. So the causes of a thoracic pain or mid-back pain could be problem with the facet joints, it could be problem with the disc, it could be problem with the vertebral body, problem with the nerve, a problem with the muscles, or even what we call referred pain, that you have problem with the organs in the chest or the abdomen that refers the pain and to the back to the back or to the spine. So how do we differentiate between all of those types of pain? If the patient have a problem with the facet joints, typically the pain is over the facet joints in the mid-back, a lot worse when you sit or stand or walk for a long period of time. If you lay down on your back, then the pain is better. So typically this will be a facet pain. And the source of the pain, the facet joints. The facet joint pain could be due to osteoarthritis, could be due to inflammation of the facet joints, could be due to rheumatologic disorders affecting the facet joints. A muscle pain in that area also can produce similar symptoms where you have pain over the area, a lot worse when you sit, stand, or with activity, better if you lay down. Now, if we look at the nerve pain, so if you have a disc that is pushing on the nerve, then it will produce pain over the disc area in the thoracic area. The pain radiates into the chest area, can cause also numbness and tingling sensation of the chest area. It could be on one side or both sides. The pain is a lot worse at nighttime or when you lay down, and that's typically a disc pain. Now you can have a vertebral body pain, especially if you have osteoporosis. You can have vertebral fracture or after trauma. The pain is sudden, the pain is severe, the pain is typically non-positional, or it can get worse when you sit or stand for a period of time. It slightly gets better if you lay down, but it is constant pain. Also, if you have a pathologic fracture to the vertebral body, or God forbid you have a tumor in the vertebral body, it can produce similar pain that is severe pain, constant pain. Most likely it does not change, but it can get worse when you sit or stand for a long period of time, but the pain is constant. Now also you can have a nerve pain. So for instance, if you have post-herpetic neuralgia or if you have shingles, then it can affect particular nerves in the dorsal spine. And that will produce a burning pain, numbness and tingling sensation over that nerve. It could be on one side, typically on one side, or it could be on both sides. And finally, you can have a referred pain. So if you have a pathology of the organs of the chest or the abdomen, such as heart problem, lung problem, or any abdominal organ problem, that can produce referred pain that can shoot to the back or to the dorsal spine. As we can see, there are a lot of causes for thoracic pain or dorsal back pain, and it is important to differentiate between these pathologies because the treatment is different, and certain pathologies need to be addressed urgently so it can be treated early on. And thank you.